launch the recording. Just to know.
Oh, geez, already. Okay, here we go.
Oh, no. Just because yeah, it'd be a good idea, because then that thing goes away and then I don't know if it's recording or not. That's fine.
Okay.
Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. Today on the Interviews with the Experts series, we have someone really, really special on the other side of the line. Dr. Emilie Salomons is a doctor of TCM. She is a registered acupuncturist. She is a doula. She's a fellow of the ABORM. But today, she's actually going to be here to talk about one other of her jobs, which is the co-presidency of the OBAA. The OBAA is the Obstetrical Acupuncture Association. And I've mentioned here before that I now too have a role on the board of directors. So instead of you hearing it from me, why not hear it from the co-president and find out all about the OBAA and the big news that the OBAA is going international. So if you are watching this and you're an acupuncturist with a special interest in anything to do with pregnancy, obstetrics, get in touch and we'll leave all the details here at the end. And I hope you really enjoy this interview. And without any further ado, let's go to split screen and talk to Dr. Emilie Salomons. So on your introduction, I was going through all the amazing jobs that you do and everything that you have on your table at the moment. And in particular, one of them, which is the co-presidency of the OBAA. But what is the OBAA? Can you tell us a little bit of the history behind it and how it started and where is it at now?
Sure. So the OBAA was originally created 5 years ago as the Canadian Association of Oriental Obstetrical Medicine, a real mouthful. Our aim was to connect practitioners who worked with pregnancy and childbirth and postpartum. We wanted to have kind of one place where they could go to access the newest research for perinatal obstetrical acupuncture, where they could get classical cases and kind of up-to-date guidelines like induction guidelines or information on gestational diabetes, any information that might be beneficial to the members. And also to advocate for a profession and to protect our scope of practice. So we were really lucky enough to get some amazing advisors like Deborah Betts, Sarah Budd, Sharon Weisenbaum, Claudia Sikovitz, Laura Ehrlich, Janny White, Sabina Wilms, all as part of our advisors, which we were in awe about. And eventually that created some international interest. And when that interest became big enough, we realized it was time to go international. So we changed our name to the Obstetrical Acupuncture Association. And here we are. Our main goal is really just to create community.
So, and that's, for more information, obviously people can go on the website. I'll leave it down here, which is ob-acupuncture.com. And obviously they can send any questions that they have as well. But for us here internationally then, I know you mentioned a few names that people will know anywhere in the world really, because if anyone has any interest whatsoever in terms of pregnancy, they will recognize those names. But for anyone, so outside of Canada, where the association has been going now for 5 years, what is in it? What is in it for me? Like as a practitioner, why should I join the OBAA?
Yeah. Everybody wants to know what the benefits are. Well, hopefully they would benefit from access to our members only section. So on our website, anybody can go on, but you'll see there's a section that says members only. There's a password that all of our members have access to, and that's where we archive all of the obstetrical and perinatal acupuncture research. And if have ever had to weed through the research that's out there now, it's really nice to have kind of a one-stop shop where we've got amazing research contributors who are constantly emailing us with like, hey, this is a new great study. So we're putting them all up there so you can go there and say, okay, I really need some studies. I'm going to be talking to some obstetricians. I need some studies on inductions. And you can go to the resource section, and there are some ones that research fellows have actually weeded through as, some pretty good research and even some commentary on it as well. So there's that in our members only section. There is classical cases, and we're building on that. And now that we've got Sabina Wilms and Sharon Weisenbaum and a few other members who are classical buffs, we're starting to kind of build that classical side as well, which is really nice. And so there's that. And then we've got an email forum, and that's starting to get going. So if you've got, a difficult case that you want to talk to some people about, or you've just had a day that you just need to share. And when you're doing obstetrical acupuncture and you're treating pregnancy, sometimes you really need to, discuss with other people. So we've got a great email forum that's for our members. And finally, the OBAA is here to defend our scope of practice. And we've already actually had to do that. In British Columbia here, there was an event that occurred that actually put at risk our ability to do inductions. And what happened was the college, the BC College, contacted us and said, this is what's happened, what are your take? And we actually helped find a way and a solution to keep induction in our scope of practice as acupuncturists, rather than what they had originally thought was, okay, let's just take it away. And so hopefully globally, we're also going to be able to work on helping protect our scope of practice and maybe even expand it for the countries who aren't even allowed in the birthing room, which is unfortunate, but very, common. Being able to hopefully, the vision is down the road, being able to help be a voice to make some changes, some really important ones.
Yeah, because you see, going from my own example, so the first time I heard about what you were doing there was actually through one of the roundtables. So
okay.
That was, when it was mentioned to me, I said, oh yeah, I remember. I stayed up one of the nights, the thing about the time difference. Yeah, I remember staying up one of the nights about this. So this is what it's all about. And then obviously the community spirit and everyone helping each other. And actually that sharing of experiences, as you say, that certain countries will have, even sometimes within states will have that different type of approach. How much and how present can the acupuncturist be? That exchange is just phenomenal, because it actually gets the other countries to up their game as well, and to be able to access all that knowledge in that community spirit. That's amazing.
And so many of us practice alone, right? I mean, I'm really lucky. I work at AcuBalance. We have a lot of colleagues. We can bounce ideas off each other. But most of us work in, some of us in rural areas or in countries where there's not a lot. So to just have this where anytime you just, okay, I've got a really crazy case. Who has experience with this? And then to really get that conversation going.
And you can actually see it from the other point of view as well. If someone is in a place where, unfortunately, because of the legislation or at whatever stage they are, that they already have done some either online or actually in presence courses on obstetrical acupuncture, and now they can communicate with other people doing a little bit more and maybe start developing their own country. So, there's always going to be a starting point. So that's good. So more importantly then, how do I apply?
Very good question. That's a step one. So we actually have two streams. We've got the general membership and the senior membership, and both are outlined on our website, which you've said is ob-acupuncture.com. And all you need to do is go to our website and then click on the membership application tab. And at the bottom, there's a little form for you to fill out. So because you're filling out with a pencil for you to fill out, I should say. And then what will happen is one of the membership directors will contact you from there. And we've got, as I said, the two different streams, the general membership and the senior membership. So for the general membership, you need to have either proof of license, so you've got a license from the region that you're in, or that you're studying Chinese medicine. So what's nice about the general membership is even if you're a student and you're interested and you say, this is a field I'd like to go into, you can just show proof that you are studying. And then the completion of 14 CEUs in obstetrical coursework, and then the exam. And for the senior membership, you would need to have proof that you've been practicing for 2 years. We've changed it now, so it's a birth knowledge videos that you go through, or if you actually have the luxury of being able to attend births, to show that you've been at 4 births. So either or. and then the completion of 40 CEUs, so 40 CEUs in obstetrical coursework, the observation of a prenatal class or a doula training, whichever you want, and we're pretty flexible with whatever's in your country and area, and then the completion of the exam.
You mentioned the word exam, what, 2 or 3 times there? You know, this is probably the time where everyone's going, no, I'm going to stop watching this video now. So,
yeah.
Okay, so an exam, why?
Yeah, I feel like we're all really traumatized by our licensing exams. I mean, I had to do an acupuncture license, and then a practitioner's license exam, and then a doctor's license exam, and then I sat the ABRM license. And so now every time someone says exam, and you kind of get that like little bit of a twitch. I just want to say right off the bat, this is not a licensing exam. This is nothing like the trauma we have been through. I promise you. It's 100 questions. It's open book, and you have 3 hours. So if you don't know the answer, you can go look it up. You can Google it. You can do. So it's not about really making it, you know, extremely difficult to get in. It's about kind of creating a baseline of knowledge, so everybody going into the association has a general understanding of birth, and then it's more about colleagues discussing. So it becomes a lot more fruitful, the conversation, and you're not having to deal over and over with kind of really the beginning, like what are contraindicated points or something like that. You're actually having conversations of like, hey, I had this case and it was really difficult, and it's a little bit better that way. I mean, I promise that most people, if you've been working in pregnancy at all, most of this stuff is going to be really easy for you. And the questions you don't know, like I said, it's open book. So you'll be able to look them up. And then after that, you're going to know the answers. So it's actually a bit of a learning experience while you're at it.
So that's a very good point. And look, for full disclosure, because I think I mentioned this to even to people in the clinic, but I'm here now kind of like playing that devil's advocate on asking all the tough questions, since I have the co-president here. But for everyone that knows that I'm actually helping on the board as well, I actually said that about the exam. And I mentioned it to other people. And as you know, since joining, I've had like 3 or 4 different conferences in different places, and that was always one of the questions that came up, was another exam. And I said, you know what, just as you said, like some of those answers was just like, yeah, I know that one. You know, there's always going to be the one that you go, hang on, now is it this one? No, definitely that one. But the ones that you don't know and you actually have to go and look it up, those are probably the ones that you'll never forget again, because those are the ones that kind of make you think about it. So I found it quite useful in that sense, that, you know, things that you might have forgotten because you don't do as often in the clinic, or, you know, just that simple exercise of having to sit down, taking the time and actually do it. I think to me, it was really, really useful. So I can say to everyone that yes, I was thinking about another exam, but I found it really, really helpful.
Yeah, and I remember when I made you sit the exam, you did have that like, oh, no. But it's not like, I promise, it's not a licensing exam. It's really just kind of the base bar to come in, and then that's it.
And I think that's important as well. So we both know about the ABORM, and I will be sitting the exam now on the next one. And it's nobody wants to do it, but you kind of have to have that standard where you then say, look, this is where it started, and then you move on from there. You know, I think that's really, really important. But what you were saying there actually brings me to the next question, just to explain to people as well. So you're in Vancouver, BC. I'm here in Dublin, Ireland, and I actually sat the exam already. So how did this happen? For anyone applying internationally, do they have to go somewhere, or what way do they sit the exam?
Yeah, we had a lot of discussions about this, because it's completely unreasonable to expect someone from everywhere around the world to fly, unless, you know, we all have extra money. But so we've gone very high tech, I have to say. And luckily we've made it now online, which means that once you apply and you've put, whether it's general application or the senior application, you're going to get a link, and you click on the link, and then you have 3 hours from that point to do the exam. If you didn't pass the exam the first time, then you actually do have another 2 chances to write the exam as well. So it's not, the end of the world. People who get like anxiety with exams, it's you do have another chance if you need. But it's all online. You can do it from the comfort of your home, in your pajamas, with all your textbooks strategically placed around you. It's very easy, very straightforward.
That's what I was going to say. Just again to reinforce that it is open book. It's more like the exercise of making sure that it's in your head, and you have the time as well to go through it as well. So I think it's a really, really good option. And at least you're not making people having to take more time off the clinics and having to fly and go here, go there. I think that's a very, very good option. So can we go to the next, oh, now I have to do something else. What about the birth experience? I know this was something that we talked about before, and people are going to be asking this question. And again, we go back to different countries will have different where they are at different places, and you may not be actually allowed to be in the room. So where is it at? If I'm applying, what do I need to do?
So this is a very, very fair question. Originally, when we created this, it was a Canadian association, and in most areas in Canada, you are fine to be able to bring in an acupuncturist into the labor and delivery room. That is not the case in even some areas in Canada, and definitely not the case in all countries. So we've done a lot of thinking about how we're going to do this, and what we came across, what we decided on, I should say, is doing one about creating kind of birth knowledge and understanding of birth. And so I imagine most of our members won't actually be attending births at all, or at least not regularly. But Chinese medicine isn't a reductionist system. We treat the whole. So a part of treating the whole is understanding the whole picture, whether you plan to be there or not. So no matter what part of pregnancy you're treating, the outcome is to have a healthy labor and childbirth for both the mother and the baby. So even if, say, I don't personally attend a patient's birth, which most of my patients I don't, I want to ensure that the patient has a healthy childbirth. And in order to do that, I need to understand really what it looks like in labor, and what I'm preparing the patient for. And Hollywood does a horrible job at representing what labor is. And so we really want people to know, what does it really look like? What stages, it's not linear. It's not 2 centimeters an hour. It's, we want to get kind of the raw, gritty feeling of what, and different, types of labors. And so, to really truly understand it, it's a lot easier when you've kind of seen and kind of the videos that we've put in, hopefully you can kind of feel like you've been there. But an example I like to use, so as we've mentioned, like I did the ABRM exam, I treat a lot of fertility, and a lot of my patients do IVF. And I am not an IVF doctor. I do not hope to ever touch my patient's sperm. I do not hope to ever touch my patient's eggs or put them together or do any of that stuff. But I know exactly what happens in the IVF process. I know what it's like to have the retrieval, the transfer, what's a good outcome, what's a bad one, what are some of the complications, because then I can help my patient, guide them through, and inevitably our patients have a better trust and relationship with us than they do with most doctors, because they see us so much. So that means we end up answering a lot of questions that, like, I don't do IVF, but they're asking me all these questions about their medication or about this, and is this a good response? And the same thing with childbirth. And most of my patients, I'm not at their births, but they're asking me, oh, like, should I go with this midwife or this doctor? And my last birth, I had this and that happened, and like, I've been told that I'm posterior. And to really understand what that means in the actual birth, it's a lot easier when you've seen it and you kind of really have a good sense of what you're preparing them for.
Absolutely. Yeah. And look, knowledge is power, isn't it? So if you know it, and if you can transmit that to your patient as well, patients are going, so like, just to give you the example, yes, here in Ireland it's the same thing. So we would see the person, although I do a lot more of the fertility scenario, a lot of the times, as you know, the patient will continue to come to the clinic through the treatment and to the pregnancy, and then towards the end, as in preparation for labor, there's always going to be questions. you know, and as the only male on the board at the moment, I kind of appreciate knowing a little bit more, because I will never experience it, but I can try and get as much knowledge as possible to inform the patients in the clinic. And again, we're talking about now not being there, but what if things change next year or the year after, or you know, what then? You know, it's better to know.
Yeah, and even, I mean, and realistically, a lot of the people on who are currently members who have access to going to births, and even myself now, a lot of times it doesn't fit with my schedule to attend the birth. I might do like an induction in a hospital once in a while, but I don't do a doula work where I'm there for the full thing. But understanding it, I know, you know, the right questions to ask, or you can see if someone has kind of the wrong idea about what it's going to be like, and you can kind of help guide them. It really is, it's just, we don't treat the uterus, we treat the whole body. We don't treat just first trimester, we're treating the whole picture of the birth, including a really healthy childbirth, so that in the postpartum they can be really strong, their chain blood can be still maintain intact, and you can do that better when you really understand what that whole picture looks like. So it's not to make things more difficult. And we do realize that most people aren't going to be attending births, and it's not because we're trying to prepare them to attend births, but just so that they understand the whole picture.
Yeah, I think that's a very good point right there, because, you know, over the last few weeks, we've been trying to talk to everyone. And one of the things that I was doing, I said it to you, talking to Sarah Budd and talking to Deborah Betts on the phone as well, that was actually something that came about. Like, doing this, it's not because of preparing you to be there, but it's to have that knowledge, because, as I said, like, the patients might ask you in the clinic, or it'll be of some use for you as a practitioner to actually know what are the outcomes. Look, every birth is different anyway, so it's not as if you're going to attend all of them and you know exactly what's going to happen next, but at least you'll have an idea and have a general picture of kind of what to expect and how to guide the patients.
Yeah.
You know? Which is something that it's really, from the moment that you sent me the first text that you wanted to talk to me, and like all the excitement of being involved, I can see, and hopefully people will see that as well from the website and from all the work that's been put so far. It's that passion and that wanting to do more, that it's been really, really good. And hopefully people are seeing that as well, that, okay, yeah, it might not be needed, but let's do it anyway. And one of the things that I said to Siobhan is that I want to go to one of the prenatal classes. I just want to see what it's like, you know. And I know that's part of that's one of the requirements as well, isn't it, for the for the application?
For being a senior member, we require that you either audit, so you sit in on a prenatal class or a doula training, and it could be a prenatal in a day, or the full long 6-week prenatal class. And the reason why we ask this, again, we know you're probably not going to be attending births. The reason why is because prenatal classes are a great way to understand what the options are locally for your patients, as far as primary care, birth attendant options, delivery options, interventions in your area, rules and regulations, because these prenatal classes are all about preparing the women for the choices that they're going to be having and given to them. So by you going to, like, ideally people are going to be going, I mean, I'm not going to be picky about where you took your prenatal class, but generally, if you're taking one in the country that you are working in, you actually have a way better idea of what is available to your patient. So then when they ask you, when they're, you know, a day pregnant, what do I do? A midwife or an OB or a doctor? What's the difference? You can say, okay, you know, in our country, this is the difference. These are the benefits to this one. This hospital does this, and home births are that, because the prenatal class kind of walks these patients through all those things. The other thing about doing a prenatal class that is really great for us as practitioners is that you now are creating a relationship with a prenatal educator who's having this constant flow of pregnant patients. So a lot of times prenatal educators will let you sit in free. so long as you don't take too much of the time and you don't ask too many questions. You can kind of sit at the back, and we call that auditing the class. Yeah. And it's good for them because you will, you know, be a referral system for them, sending them clients. And hopefully, if you get a good enough relationship, they'll also send you clients. So by doing this is kind of like also a sneaky way of kind of really building the community that you're going to be in. So you get to learn about what's available in your area, and you create relationships. And so it's generally a very beneficial thing to do.
Yeah. And you know, I'm here thinking about something else. I bet you that from everyone who's going to be in that class as well, some of them might know about acupuncture. Some of them might have the same old question about acupuncture during pregnancy. Oh, I didn't even know that you could do that. So you're creating that relationship as well, that I had an acupuncturist sitting in my class. I didn't even know that you could do acupuncture. Tell me more about this. So yeah, there's another aspect.
After class, there's a lot of conversations that happen, and if you're really experienced but you've just never sat a prenatal class, then you could even talk to the prenatal coach about like doing a little 20-minute talk on acupuncture for pregnancy for free, and they might really like that. So you know, there's a lot of different options, but it is really helpful to be able to sit, because what we're talking about in the association might be very specific to one country that the person who's talking, you know, it's relevant to them. But then if you've sat your prenatal class and saying, well, actually, no, in Ireland, it's a little different, or like, well, you know, that happens here, but here it doesn't, you know, that kind of thing. So.
But I think that one of the beauties of the organization is the way that you were able to actually get those advisors for the organization that look at the difference between. It doesn't really matter where you are in the world. You probably at some stage did some sort of training, either one day or weekend or online, with Deborah Betts, Sarah Budd, Claudia Sitkovits, Laura Ehrlich, Jani White. At some stage, like I started studying Chinese medicine in Portugal, and I knew about these people. And when I moved to Ireland, people here knew about these people, and eventually I found a way of doing courses at that stage was actually in person with them. So does it really matter whereabouts in the world you are? If you get the organization with these, you know, these names behind you that are actually advising you on how to do things, I think the members or the potential members can see the value of being part of the organization.
Well, I really like that the advisors are from different countries too. So we're not just all advisors from Canada. We're actually, I don't know if we have any advisors. Advisors from Canada. Jani White's originally from Canada, so we'll just she can represent Canada. But really, they are from, you know, we're from different areas, and we want to grow our advisors as well, and so that we can have like more representation in China and a few other areas around the world. So we've got really good sense globally, and that's also going to help as we start kind of trying to expand the scope. And and one example I wanted to do about the differences and why it's good to do a prenatal class in your area is that I had a patient from, I want to say Cyprus. I'm blanking a little bit, but it was a small island off of Italy. And she actually was coming to Canada for her birth. She was originally Canadian because she couldn't find a doctor in Cyprus who would let her have a vaginal birth.
Oh, wow.
They had 100%, they only did C-sections. And that was just the reality. And so she had come, you know, because she was like, I want a vaginal birth. But I mean, it's to say like the hospital that's near where I work is amazing. They do phenomenal things, but I don't expect that to be the same in every country. So it's you get to really get a real sense of what's actually going to be offered in your area.
So there's 2 layers of membership. The website is up. Everything is running now. I take it that the members at the moment will be Canadian only. There will be then the intake internationally. How does this work then in terms of being listed? How do people find these practitioners that meet the requirements? They're going to be on the website?
Yeah, so we've got, like I said before, our senior membership and our general membership. Okay. I imagine everyone will want to be a senior member at one point. And that's just because the senior members are the ones who get to be listed on their, you know, they take a bit of a advisory role. But the reason why we kept it as a dual track membership was to be more inclusive to the people who didn't quite meet all of the requirements. Yeah. So maybe you've been out of school for only a year, but you're just really raring to go and you really want to be part of this. Or you have everything except you're not going to be sitting a prenatal class until the spring because you had no idea and you had no intention. And now you're like, okay, well, I guess I should, but you can't get into one for another 4 or 5 months. We still want people to be able to access all the resources in the members only section and take part in the email forum. And then as soon as that person is ready, just like that, they just give us the rest of the requirements and they become a senior member. We don't have a cost to go from general to senior. This isn't a tier system. It's literally just, if you don't quite meet all the requirements, we still want you to be part of the association. We still want, because we know that, not everybody will have thought to do all our little, random checklists that we put out. But if someone's really keen, really excited to be part of it, we want you to be able to get access to that and to join the conversation now. And then whenever you're ready and you feel like it, you do the rest of the requirements and you're on the website. Easy as that.
But that's actually a very good step up, isn't it? That as you were saying, if you're only graduate and you already have that interest in studying more about, you're still going to need time to do your extra training in that particular area anyway. And the fact that you're actually allowing them to be part of that community and access the studies and obviously access the website and the emails, that's brilliant.
I would have loved it. Like, I think about, because I was really excited about pregnancy and gynecology right from as soon as we started taking it in 3rd year or 4th year. And I'd started taking courses, but if I could have had access to all this information right off the bat, I mean, a lot of times the students coming out are the most keen, or maybe you've been practicing for 20 years, but you were doing cancer and suddenly you said, I want to mix it up and you're not quite there, but people are ferocious learners. They want that access, and here they can jump in. So it's not about a hierarchy of who's better than who or anything like that. It's literally just, we want to be more inclusive and we want everybody to kind of be able to have access who's interested and who's working with pregnancy. But we want to have the goal to be, like I've explained with each of we have a reason for having each requirement. And so we want to keep those in there, and we want people to aspire to do all those things so that they can become the senior members.
Yeah. But at the end of the day, you're not excluding anyone because you're actually allowing them into the group, except just getting to those extra requirements and then fully join as a senior member. I think that's a very good point to put across.
And if we're going to be having people from just like a lawsuit kind of position, if we're going to be listing people on the website, they we want to make sure that it's someone who has a lot of experience and who's going to represent the field really well. So there's also that, like, we really want to make sure that we can grow this field, because it's such an amazing field and there's so much you can do in pregnancy and so much you can do in postpartum, and you can make such a difference in someone's life and such a pivotal point in someone's life, having a baby. And so we just want to make sure that we do it as well as we can, and that it inspires people. And I'll say it, we want to push you a little, I'm lazy. I'm lazy. If I didn't have, a boss that was always like, all right, do another course, it would be very easy to just take the weekend off. But sometimes you need a little push to just do that next level. And so, part of it is just kind of, a little gentle push, but in the end, we want everybody to be able to have access. And so we did the general membership so that it was easier for people who were keen, but not quite there yet, to still join the conversation.
Yeah. So ob-acupuncture.com, this is all kicking off. You'll be hearing a lot from us from the 15th of November. Is going to be the official launch. Is there a party for the official launch?
Party of one! Woo! I wish. But I think at IFS in Vancouver, 2018. If you haven't already, if you're thinking about it, they have a whole pregnancy stream, and there's going to be Deborah Betts. There's going to be a lot of, I think Sarah Budd's coming back, and I think Jenny White's going to be there. There's a lot of advisors are going to be there. We're going to have simultaneously our AGM because we have so many members coming in for that. So if you happen to be doing IFS and you're coming in for that, please come. We're going to have a big dinner and we'll have our party then.
So for anyone watching this now, they can get in touch. They can start the process. They just go on the website, fill in the form. Someone will get in touch. Is there anything else that we need to tell them? Did we cover all the questions that they might have? They can always get in touch.
I mean, we're creating a frequently asked questions section on the website for these questions. So if you have any other questions, there is a contact us section on the website. So go there, ask the questions. Yeah. If we get it a few times, then obviously it's an important one to answer, and we'll make sure to add that to our FAQ section. But yeah, don't be shy. If you don't think you meet the requirements, or you don't understand one of the requirements quite, like I didn't do a good enough job now explaining them, do not be shy. Just ask. And we'd be happy to answer them.
And the feedback's been great from the conference that I've been at. I've seen applications from people sending paperwork. There was someone from Australia recently. There's a few from the UK. Obviously, there's a few from Ireland, and we've been in talks about this as well. So there might be more than a few from Ireland, which is great. And the US as well. Actually, now recently at the other conference, someone from the US was in touch as well. So the word is getting out there, and I think that it was important for people to know these details as well. And sometimes go on the website can be a little bit dry. So it's good to know that, and people can follow us on social media as well, because we'll be.
And we're constantly growing and changing and throwing out ideas. So we're looking to give value for your membership. So if there's something, once we start getting members, if there's something that members say, we do our roundtables as well, which a lot of people know about. And those are free for even non-members. You go to Medagogy. We do those 3 to 4 times a year. But yeah, we're always looking at how can we give more value, and how can we make this something to be exciting to be a part of. So yeah, hopefully it's going to grow, and we can do even more amazing and exciting things, and things that people think are going to be really important for the profession.
Yeah, I was going to say that about Medagogy. I was going to leave the link here because the last one was on gestational diabetes. Can't remember the one before that.
There's one that I did on induction, and then the one before that we had breastfeeding. I think we did one on lactation. We've done one on breech, but I think we did one on breech, but it didn't record properly. There was some technical issue. So I think we're going to do another breech one. So if people have ideas of what they want, and those are all free 1-hour lectures that are live, and then they are recorded, and also they get archived into our members only section, so you can just kind of dip through
And it's a good example now, even for anyone who wants to just have a general idea of what it could be when you get some of the practitioners together, and in a discussion, they can just go on Medagogy. So I'll leave the link down here, and they can check it out, because it does give a little bit of a flavor, and it's great. So listen, Emilie, thank you so much for your time, and I suppose I should say that I wish you all the best and all the success, but that's going to involve me doing work as well, right? So November and December are going to be busy, is basically what we're saying. Yeah. Okay. That's cool, yeah.
Hopefully very busy. Busy is a good thing.
So yeah, leave us your questions. I'll just go on the website. There is a contact us form there, but you can leave it down below in the comment section on this video as well. And just follow us on social media, and we'll just try and get to you as quickly as possible, since we're going to be so busy now in the next few weeks, eh? Thank you so much for your time, Emilie. Really, really appreciate it.
Yeah, no problem. Thank you.
Oh, baloney. The whole thing always gets back to drugs.